Let me have juice and soda.
You should watch how much juice and soda you have because it can cause cavities. That's why you should brush your teeth 2 times a day for 2 minutes. You're listening to Your Dr. Right Kids Edition.
So how much TV time can I have in a day?
Us kid doctors recommend no more than 2 hours a day. Listen to my mom's podcast, You're Dr. Right, to learn more about this stuff. Thank you for watching.
Hi, everyone, and welcome to You're a Doctor, Right? The medical podcast that answers all your burning medical questions. I'm Dr. Sonya, and I'm a board-certified radiologist. And before we get started on this episode, I just want to talk about how this is my 10th episode. So it's the last episode of the first season. I can't even believe we got here. And I say we because I just want to embarrass them for 1 minute. And I'm hoping that my producer, Jess Toddville, can just kind of come into the picture here. Jess, can you come in? So I just want to introduce everyone to Jess. He made this podcast dream come true. And I didn't mean, if you were to told me a year ago that I was going to have a podcast, I wouldn't believe it. But then the universe brought Jess into my life, and here we are. So thank you for everything you've done for this podcast. It's been so fun.
You are so welcome. I learned something on every episode, and I know I'm about to learn something in this episode.
Yes, well, I do too. So that's what's so exciting. And thank you so much, Jess, for everything. Our guest today, I'm so excited about. I thought that to kind of hold this whole podcast together, we talked about dermatology and pediatric, and we talked about anesthesia, and we talked about nutrition, and we talked about everything. And you might have noticed that I actually avoided breast imaging. And I thought it'd be fun for the 10th episode to kind of bring it back to breast imaging and interview my first breast radiologist, Dr. Roth. So thank you so much for being here.
Thank you so much for having me. I'm sorry I'm in my car. As we know, working moms, I'm leaving my shift, about to go pick up my kids from the pool and, doing it all.
I think when we were talking, I was like, this is exactly it, right? I mean, we got on the phone and we talked, I think, for 45 minutes. We were supposed to talk about the podcast, and we didn't even get to the podcast because we were talking about so many other things, and so much of it came back to being a busy mom. So I get it. It's amazing that you're even able to do this. I'm so excited. So I'll take you in your car anywhere. So thank you.
Thanks for having me.
I'm just so excited to have you. You are our first breast radiologist. You're the first breast radiologist I've actually ever interviewed. And I just thought it'd be nice to bring it back with our 10th episode to kind of bring it back to breast imaging. So thank you so much for being here.
Breast is best. That's what I like to say.
Yeah, I love that. And, I love all your breast sayings. And I always say every month is Breast Cancer Awareness Month. So I love that we're doing this not in October.
Yes.
Because I think that's when people remember. And I think we should be thinking about it all the time, as I know you agree.
Before we get started on our episode today, I want to remind all listeners that the content of this podcast is for informational purposes only and does not constitute formal medical advice. Do not delay in seeking professional medical care because of something that you have heard in this podcast. If you have any questions regarding your own health, please talk personally to a doctor or other healthcare professionals. Relying solely on the information provided in this podcast should be done so at your own risk. Now that we're done with the paperwork, let's get started on this episode today.
So Robin Roth is a breast-trained, board-certified radiologist, but you might know her better as the Booby Docs on social media. Robin, I love your social media page. I find it so inspiring. For those of you listening, I slid into her DMs to ask her to interview with me because I just thought it was great. There's so much misinformation. I know you'll agree with me. There's so much misinformation out there. And to find someone that's doing evidence-based medicine in a fun way is just really refreshing. So thank you for all that you're doing with that. And I also just want to put in a pitch that you have your own podcast. It's The Girlfriend's Guide to Breast Cancer. Is that right?
Yeah, The Girlfriend's Guide to Breast Cancer, Breast Health, and Beyond. So I like to just focus on, breast health in general. I think, by the time it's cancer, it's not that it's too late, but we want to get people talking about their breasts all year round, like you said, and being aware about them before any problems develop.
Absolutely. I couldn't agree with you more. You've heard my podcast. I usually start off by asking, I think it'll be fun to hear your answer since we do the same thing. What is the most common question you get as a breast radiologist?
When should I start screening mammogram? And and who gets breast cancer, I guess, is the biggest two questions I get. And so we know that, the recommendation is that average risk women should start screening mammography beginning at age 40 every year for average risk individuals.
And I really like to highlight average risk individuals because we know that high risk individuals need to start breast cancer screening earlier and more often. So as early as age 25 for MRI and as early as age 30 for mammogram. And that really brings up the conversation of, well, we need to understand our breast cancer risk factors. And I think that all women, and you agree, because this is a Society of Breast Imaging recommendation, is that all women, especially Ashkenazi Jewish and Black women, should have a breast cancer risk assessment before age 30, ideally at age 25, so we can identify high-risk individuals who would benefit from earlier and supplemental screening.
Literally couldn't agree with you more, which is why I'm so excited we're doing this together. And let's just reiterate that one more time. All women by the age of 25 should have risk assessment, because we say every year starting at 40, but we're not taking into consideration, like you said, not everyone's the same. We know that there are factors of ethnicity. We know there are factors of family history. We know there are all these factors that might not make you average risk that you might not even be aware of. And that's why it's so important to get that risk assessment.
Yeah. And it's so easy to find out your breast cancer risk. You could use the online free calculator, the Tyrer-Cuzick calculator. We could put it in the show notes, but I think it's really important. Olivia Munn has been talking about this a lot when she was diagnosed with breast cancer, that, she really found out she had breast cancer because she had a breast cancer risk assessment and she was 38%. So high risk is over 20%. So it's really easy and a simple online tool that you could find out your breast cancer risk by plugging in your family history, your age, your, a number of factors that are pretty common knowledge, and find out if you are average or high risk.
I totally agree. And just to kind of exactly what you said about Olivia Munn, I love that these celebrities are using their platforms to really spread the word. And just to add one more thing to what you were saying, when she found out she was a higher than average risk, she had an MRI ordered, and that what actually eventually found her cancer, as you know and have talked about. So I think that's really important, is that we're saying, patients might need not only mammograms prior to age 40, but might need supplemental screening such as MRI, to make sure that there isn't anything hiding in that. We know that MRIs are the most sensitive examination.
Yeah.
I love that you bring that up. You're one of your recent reels. I think your social media is so great. You start watching, you kind of get addicted to watching, what you're doing.
Floating in the rabbit hole of
it's great. I mean, it's creative content. But one of the things you just posted, which I loved, it really resonated with me, was, what do we do as healthcare providers, patients that might not follow your recommendations? So I think you said it on your social media. The thing we face daily, maybe not daily, but weekly, often, I would say, people that come in and not wanting their mammograms. And I do exactly what you do. I think it's really important to remember that this is an age of personalized medicine. So people are informed, they do get to make the decisions about their own bodies. And can you talk a little bit about that? Because I do face that daily, and what you do to talk to patients about not wanting mammograms, and maybe what are the most common things you find people that are keeping people from getting their mammograms?
Well, I think it's really important to understand why someone is declining a mammogram, and I think that's the biggest hurdle is, what is it? Is it a fear of radiation that has maybe been instilled through social media, this false exaggeration of how, that I see a lot of misinformation on social media that mammograms cause breast cancer, and that, but if you keep getting mammograms, you're going to develop breast cancer. And I think that is the biggest misinformation spreading, and it's very dangerous misinformation. So we know that the dose of a mammogram is incredibly low. We liken it to about 7 weeks of background radiation, and that's just really to demonstrate how minuscule it really is. But the benefits of mammography is that it can find microcalcifications and some of the earliest signs of breast cancer that ultrasound and even MRI cannot. So, that small amount of radiation may be able to find your breast cancer at its earliest, most treatable stage. And once we find, the goal of breast cancer screening is to find your breast cancer at the earliest, most treatable stage. I always like to say early detection is the breast protection. And that really is because, when we find your breast cancer early, like, you can benefit from the 99% survival rates of early stage breast cancer. Obviously, those numbers go down as you get diagnosed with later stages. And thankfully, treatments are getting better. So, breast cancer is not a death sentence. But it's always, if we could find your breast cancer early, you may be able to potentially avoid more aggressive treatments like chemotherapy, lymph node dissection. All of these things have consequences and can decrease your quality of life down the road. So we want to set you up for the best quality of life after breast cancer. And I think that's the goal of breast cancer screening.
Yeah, absolutely. And, again, I think all of us were really touched by Ananda Lewis's death, recently. And, she really put in a pitch on her social media to not forget your mammograms, that she had deferred mammography, and how she urged women to get mammograms because of finding that, and I think that was such a beautiful and poignant point, that she's using her own story to say, don't defer your mammograms, really try and get, because this is the way we catch it early. We want to catch it early. We want to catch it when it's small. We want to catch it before it's in the lymph nodes. And that is with mammography, because of the earliest kind of breast cancer, which are calcifications, which can be DCIS, as you mentioned, can only be seen on mammography. And that's why it's such an important point.
If you're looking for ways to get involved, check out the Pink Agenda. Breast cancer doesn't wait, and neither does the Pink Agenda. This nonprofit is where passion meets purpose, funding life-saving research efforts and empowering the next generation of advocates through education and young philanthropy. With so many volunteers across the country, there are many ways to get involved. For more information, check out thepinkagenda.org. And thanks for listening to today's episode.
Yeah, and I think, Ananda Lewis had a lot of, hindsight is 2020, and she learned a lot from her story. And she said, I didn't get my mammogram until I was 47. And why? Because she saw her mom go through breast cancer, and she kind of knew she was eventually going to get it, but she didn't want to know about it. And that didn't serve her well, right? Like when you are diagnosed with metastatic breast cancer, obviously it changes what your treatment plan is going to look like. And even after that, once she was diagnosed, she chose a more alternative route and a holistic route, which, in the end did not serve her well, unfortunately. And she says that, she probably could have listened to her doctors, and I think that it's really powerful to hear celebrities talking about their breast cancer journey, whether positive or negative. And we can learn a lot from that. And I think that all of this is really important in spreading awareness that, it could happen to anyone, and it's happening at younger and younger ages. So we just have to all be breast self-aware.
Yeah, I absolutely agree with you. I did notice on one of your posts, there's a lot of questions about what are the recommendations, there are so many conflicting recommendations. And I agree. I think they're really confusing. And I, just thought this could be a good opportunity for two breast radiologists just to reconfirm what we recommend. So I think you would agree with me that we say we follow the Society of Breast Imaging and the ACR recommendations, which is every woman at the age of 40 every year. Of course, earlier, if you are at high risk or deemed to be high risk, where that risk assessment comes into play. So we know that 1 in 8 women will develop breast cancer in their lifetime. 1 in 6 of those breast cancers are in the 40 to 49 age group. So important to get that mammogram at 40. And, the United States Preventative Task Force, the USPSTF, says every 40, every 2 years, ACOG kind of changed their recommendations. And now they're, starting at 40 and then every 1 to 2 years afterwards with shared decision making. And there are a lot of different recommendations out there, but the most lives saved as backed by the Society of Breast Imaging is the age 40 every year.
Yeah, every year saves the most lives. I mean, we learned the hard way what happens during the COVID pandemic. People were skipping the mammograms, and we were seeing people diagnosed with more late stage breast cancers, and especially in the 40-year-old women who have dense breast tissue, and they're more likely to get aggressive breast cancers. This is not the population that you want to be doing every 2 years.
Right.
Certainly I think as you get older, then you might consider going every 2 years, even though I would still recommend every year. But again, it's a decision-making process. Of course, weighing the pros and cons. The cons might being that you might get called back for something that's not breast cancer, maybe even more in a biopsy, but that's kind of the cost of early detection. So I always tell women, like, if you want to know your breast cancer at the earliest, most treatable stage, then you might, that might equate to like 1 or 2 extra callbacks or biopsies throughout your lifetime.
Right.
But that's the cost of early detection.
I absolutely agree. And I think, if you look at all these recommendations, that what they say, as I think you're alluding to, is the reason why we don't want to do it every year is because there are false positives. It can lead to a lot more anxiety with women. And I think that that's a really good opportunity for us as breast radiologists to really educate on that. So what is making people anxious? And I think if patients come when they're anxious about their mammograms, what are some things that they can do to kind of help with that?
And this is the thing that really bothers me about breast cancer screening recommendations is I feel like it's very paternalistic to say, like, don't, but like every year saves the most lives, but come every 2 years because of the anxiety that you might feel when you get a call back. We don't do this for prostate cancer screening, right? We say that, this is what the screening recommendations are because this saves the most lives. Why are we doing this for women? Like we could handle it. And I think that it's kind of minimizing the female experience. I think that they're placing their values on breast cancer screening recommendations when that really should not be the case.
I absolutely agree. And I think so much of the anxiety does come from, like you said, the fear of getting called back. So maybe we should take a few minutes just to talk about that.
And also, if you come every year, you're less likely to be called back. Like you just have more comparisons. And I don't want to minimize getting called back because I recently had a call back myself.
Mm-hmm.
I know you had an experience as well. I needed a biopsy. And I got to experience the patient side. And I think that's very powerful. I know that there's a lot of anxiety and anxiety around, the fear of that you might have cancer. But, I think that most people, when they have a biopsy or if they get called back and everything looks fine, or if they have a biopsy and it comes back not cancer, most people can move on from that experience and say, that was scary, but thank God everything's okay. And now I can now I can move forward with my life. Some people might hold on to the experience and be traumatized from that. And I'm not minimizing that at all. That's where I feel like it's a personal decision about whether or not you want to come every year or two.
Yeah, absolutely. I couldn't agree with you more. And I think it's really important to tell listeners. So if you look at all the mammograms that are being read, about 10 to 15% of those get called back. Most of the callbacks are going to be normal findings. Mm-hmm. You're more likely to get called back, as you alluded to, if it's a baseline examination. The more and more comparisons we have, tissue can look funny in year to year in different mammograms. And the more comparisons we have, the more likely we are to let you go. But on baselines, we're more likely to get called back, et cetera. From those 10 to 15% that get called back, over 95% of those patients are not going to have breast cancer. Over 95% of those called back will have normal findings or findings we might need to follow up in 6 months. Mm-hmm. The majority of them will be normal. And of the small percentage of those that need biopsy, the majority of the biopsies will also be normal. So
I like to give this number because I think this is a really important visualization. So if 100 women get a mammogram, 10 of these women will get called back. Yep. Okay. So of the 10 women that get called back, 6 of them will be told that everything is normal. Mm-hmm. Another 2 of them will be told that everything is probably benign. We basically follow you every 6 months for 2 years. It's a less than 2% chance of that being cancer. Another 2, so the 2 of the 10 women that get called back will need a biopsy. Of those, 2 women that of the 100 that needed a biopsy, 80% of them will be benign.
Yep.
Okay, so the numbers are really in your favor.
That's right. That's a great way of breaking it down for people to know. I think those numbers really, really help. And I think knowing those numbers will help with some of that anxiety and the scanxiety that people feel. So I think it really comes down to what I've seen in my practice, and maybe it's similar for you. The 3 things I think that really prevent people from getting mammograms are the anxiety, which we kind of touched on. It's really negligible. People don't realize we get background radiation just from walking around, in Chicago or New Jersey or wherever you are. And so it's equivalent to about 7 weeks of that background radiation. And I think the third thing that people are really worried about is the pain that they might experience. Do you feel that as well?
Yeah, the pain and the fear of like the unknown. Like some people don't want to know, but I always tell people it doesn't make it go away. Ignorance isn't the bliss.
Exactly. I think it's important for people to understand also why we do have to have that compression. Why do we have to compress on a mammogram? And, it really is because, as that compression helps us see through the breast tissue. It makes sure that all the breast tissue is moved out of the way. And then it actually comes back to radiation. It decreases the amount of radiation that we need to get the picture because we're compressing the breast. So I think for me, I hate getting mammograms too. I have anxiety about the result. All of these feelings are normal, even for a breast radiologist.
Yeah.
And gone through biopsies as well. And I think the more that we talk about it and normalize it, I think it's we've been through that too, but it shouldn't prevent us from finding that early breast cancer.
I always tell people if they're really worried about the pain that you could take, an Advil about an hour before. You also want to try to schedule it not on your period. So kind of mid-cycle would be best. And then also, practicing
breathing to exercises and mindfulness techniques, the compression is actually only for about 15 seconds max on each side. So I think that we also have to put it in perspective of like, yes, it's uncomfortable, but this is going to give me the best chances of finding my breast cancer early.
Right. I totally agree. Every time I'm in that mammogram machine, I'm sitting there and I'm like, okay, it hurts, but you know what? I'm going to be a good radiologist. I'm going to get a good picture. So I think if you just keep thinking, in the mind of the radiologist and trying to get that good picture, the stiller you can hold, the more compression we can get, just the better picture and the better we have at catching something early.
I got to tell you, I don't find it personally that painful. And I think it has to do a lot with your breast composition and just so I do think it's a more of a personal experience. I think that, but I understand that like lots of people find it very painful. I'm not that fazed by it. I mean, I think it's uncomfortable, but it's so temporary. And again, the benefits for me outweigh any potential discomfort from the exam.
Absolutely. Maybe it's a good time just to touch on really quickly dense breast. I have extremely dense breast tissue. So that's 10% of the population. That's extremely dense breast tissue. And so my mammogram is a radiologist's nightmare. Like every time the mammogram comes up, I'm like, oh my gosh, I'm not the one reading this mammogram.
Yeah.
I always use a polar bear in a snowstorm. I don't know what your analogy is, but I love that.
It's like in a snowstorm. Yeah. Same thing. Yeah.
I think it's so great, right? Because you have, it's just so easy to understand. You have a white polar bear in a white snowstorm, very hard to see it. That's the dense breast tissue. If it's a polar bear in grass, much easier to see. And I think that makes it really, really easy. And I think with the 21st Century Act and all these FDA breast density laws, which are so important, we want to do advocacy. We want patients to understand their mammograms. But it can also lead to anxiety and confusion because they see this word dense breast and we don't know what it means as a patient and what we should get afterwards. So talk a little bit about dense breast tissue and what that means for your mammogram and what you should be pursuing after that.
Yeah. So, it's a great point. And, dense breast tissue is normal and common. About 50% of women have dense breast tissue. And the way you could find out your breast density, well, now you get a notification in the mail. You either have dense breast tissue or you don't. So dense breast tissue is like a double-edged sword. It makes it harder to find small breast cancers, but it also increases your risk. I think that if you have dense breast tissue, you should strongly consider supplemental imaging in addition to your annual mammogram. What that looks like is going to depend on the institution, right? So MRI or abbreviated MRI, or we use a lot of handheld ultrasounds in patients that don't have a high risk for developing breast cancer. We also use a lot of contrast mammography at my institution. So as long as you're doing, I think, something in addition to your annual mammogram, if you have dense breast tissue, I think you're in good hands.
Yeah, I totally agree with you. I think that is confusing for patients because we use a lot of abbreviated MRI for extremely dense breast tissue with others, and we don't do contrast enhanced mammography. I think that's confusing for patients. So I think that the best advice that you just gave is that looking at your report, seeing if you have dense breast tissue, if you do, talking to your doctor about what would be the best supplemental screening for you.
Yeah.
Because it might differ from institution to institution.
Yeah, absolutely. But I still think it's important to understand that mammography still plays a role, even in women with dense breast tissue. So, obviously the sensitivity and the specificity is lowered, but it's still very important because it's the only test that we know of that can detect the microcalcification that can be the earliest sign of breast cancer. So even in women with dense breast tissue, mammography still does play a role.
Absolutely. Robin, I can talk to you literally all evening. I have so many points that I can even bring up, but I know we have to wrap it up here. I'd love to do a quick summary if that's okay with you.
Yeah, and we'll have to do a season 2 episode, I think.
Absolutely. Yes. We definitely will. Or just maybe other reels and conversations.
Absolutely.
Because it's been so fun.
Yeah.
So I think I would love to start with our first summary point with what you ended with, is that mammography is the only proven test that should save lives with the early detection of breast cancer.
Yeah.
So it's regardless of your breast density, yes, you still need your mammograms.
Yeah.
All women should have risk assessment by the age of 25, and it might determine that they qualify for screening mammography prior to the age of 40, or additional screening with ultrasound or MRI or other supplemental screening tools before the age of. So make sure you're talking to your doctor. However, all average risk women should be getting screening mammograms at the age of 40 and every year thereafter. That is how we save the most lives. I'm going to say it one more time. Every year starting at 40 is the way we save the most lives. And that's what we really, really recommend as breast radiologists.
In average risk women.
In average-risk women.
Yes.
Dense breast tissue, it means that you have, it's a little bit harder to see through. A polar bear and a snowstorm appear it. It can mask breast cancer in a sea of dense breast tissue. And it also creates an inherent increased risk. So if you do have dense breast tissue, make sure you're talking to your doctor about what sort of supplemental screening might be best for you. It may be institution dependent.
I did it better myself. You did. Yeah, thank you so much for having me. This was such a fun and important conversation, and I look forward to more of these conversations.
I agree. This was so much fun. Thank you for your time.
Thank you. Hello with the Booby Docs for more of the breast information.